Hi everyone, welcome to Center of Balance Live. I'm Szenan from Center of Balance, the acupuncturist. Well, today we're going to talk about the types of depression. So different types of depression. There are two types of depression that we're going to talk about. What are the difference between them? Right. Hi Eric, how are you? So as a practitioner, it's important to know which type of depression, because you want to let your patient know which type is it, and then the treatment, how long would it take, so to understand this is quite important. So if you're a patient, then you need to understand which type is it for you. Knowing this, you'll be understand what when you involve in treatment and how long should it take, and if the treatment's working or not, then you'll be able to tell, so when you get better, how long does it take to get better, to feel better, things like that. Right. I would like to, if you're on Facebook, please give me a thumbs up and say hi to me, and I would like to share it as a share on my personal account as well on Facebook. Right. Okay. Right. Let's start. Just making sure this all this. Right. Okay. Let's see it now. Facebook is on too. Okay. Cool. Now, well, if you're a patient, first thing first, this video I do on my I share on my acupuncturist practitioner Facebook page, as well as my clinic Center of Balance Facebook page and Instagram as well. So if you're a patient, if you would like to come and see us for your depression, and this is the number 0784609556. So we have free pre-assessment, and you can get up to 15 minutes free pre-assessment, or you can fill in a new patient form and come in for a whole hour of initial examination. In the initial examination, we will give you a treatment plan to let you know what type of depression is that and how long it takes, and according to Chinese medicine, which organs are out of balance. You see, then we set out a plan for you and to let you know what treatment involved with. And of course, when it comes to depression, Ho'oponopono method, which is the 4 phases that I introduced previously. I love you, I'm sorry, please forgive me, thank you. This is the thing that we will introduce all our patients to do in depression. And further on, you may involve with acupuncture treatment or Chinese medicine treatment. It can be both too, depending on what sort of depression you have and how serious is your illnesses. Okay. If you're a practitioner acupuncturist, you can check down there. So we have a local balance, Dr. Tan's balance method, acupuncture local balance, a webinar, and you can buy that and to learn how to step by step to go to treat using acupuncture to treat all sort of disease, right? How to diagnose, how to pick the point and meridian to balance the entire body, the organs, and treat the pain, right? And that including depression as well. Right, hi Louis, how are you? Right, let's start. So the types of depression. Depression can be broken into 2 categories, okay, depending on the severity of symptoms. So some people experience actually mild and temporary episode, while others experience severe and ongoing depressive episodes, right? So there are two main types, right? Two main types. So one of them called major depressive disorder, and the other called persistent depressive disorder. Let's talk about major depressive disorder. What does it mean? So we call it also called MDD. So MDD is major depressive disorder. It's the more severe form of depression. So it's the feeling of, if you suffer from this, it's a persistent feeling of sadness, hopelessness, and we call worthlessness, right, that don't go away on their own. It doesn't go away, no. Okay, in order to be diagnosed with clinical depression, so you must experience 5 or more of the following symptoms over a 2-week period. A 2-week period, alright? So we're gonna talk introduce another one called PDD. PDD, persistent one. Persistent one is go for 2 years. The major one is MDD, is 2 weeks. But the following symptoms that I'm gonna name, give it to you. If you experience 5 or more of the following one, then yes, and over 2 weeks period, then your depression is MDD, right? Now, if there's a test that you do with it, to go through a questionnaire. We did it yesterday, right? I name it all out, and you can go through that questionnaire to understand whether you suffer from depression or not, right? So number 1, feeling depressed most of the day. Loss of interest in most regular activities. Significant weight loss or gain. Sleeping a lot or not being able to sleep. Right. This is 4, right? Okay. Slow thinking or movement. 5. Fatigue or low energy most days. Feeling of worthlessness or guilt. Loss of concentration or decisiveness. Recurring thoughts of death or suicide. So 9 of them. If you have experienced 5 or more than that, then here you go. And over 2 weeks period, then you are the type of MDD rather than PDD. Okay, there are different subtypes of major depressive disorder, which the American Psychiatric Association refers to as specifies. This include atypical features, anxious distress, mixed features, and peripartum onset, which is during pregnancy or right after giving birth. Seasonal patterns, melancholic features, psychotic features, catatonia. So those are the different types, the subtypes under MDD. So what about PDD? PDD is persistent depressive disorder. So used to call I'm not very good in pronouncing this one. dysthymia. It should be dysthymia. dysthymia. Maybe I'm right, maybe I'm not. You know better than me. Okay, it's a milder but chronic form of depression. While we go with MDD is 2 weeks, right? And PDD persistent, which is longer, 2 years, at least 2 years. The symptom must last for at least 2 years. Okay, so PDD can affect your life more than MDD because it lasts for a longer period. So it's common for people with PDD to lose interest in normal daily activities, feel hopeless, lack productivity, have low self-esteem. And depression can be treated successfully. It can be treated successfully, but it's important to stick with to your treatment plan. Right? If you come to us, for acupuncture or Chinese herbs, or acupuncture and Chinese herbs, and with depression, definitely Ho'oponopono method, which we call emotional day practice. Right? Emotional day practice. With this combination treatment, what else can you do? Change your lifestyle. How do you change? What do you mean change your lifestyle? What I mean, diet is important. Changing diet is important to help depression, especially you have physical condition as well. So get your physical condition sorted, get the organs function better, then your emotion will get better and stable as well. So this are very, very important. So stick with your treatment plan, right? And we treat depressions successfully, so to bring people back to work and to raise their energy. With first, if you start the treatment, I do have to be honest to you, I don't want to mislead you with acupuncture and Chinese herbs and Ho'oponopono method. You feel good and feel low, good and low, start with the treatment. But as you go into the treatment, stick with treatment, low, up, low, better, low, better. As you go, it gets better and better and better and better, and it's more stable, right? Eventually you get better, right? So stick with your treatment and be positive. It's important. Again, if you want to come to see us, call us 0784679956, 0784679956 if you're a patient. If you are a practitioner, go down there and check out the link and click it and order our local balance method, acupuncture local balance, and to learn how acupuncture can treat all disease. This is a very basic courses. Then we're going to come out with we're going to promote another one called global balance, and with global balance you be able to treat all sort of internal disease. Alright, stay awesome. I'll see you next time. Bye bye.